2 weeks ago, we unlocked New Haven's best-kept secret when we learned about the Cornell Scott Hill Health Center. Today, we're talking about the importance of women's health. Dr. Tom McNamee is back with us today and joined by certified nurse midwife Heidi Beagle. Welcome to the both of you.
Thank you.
All right, the focus today, women's health. And of course, the number one thing that women need to know about is heart disease, because it's the number one killer of women.
It is.
Why is it that we don't seem to, that message doesn't really get communicated to women?
I think that women's health care is often focused just on the gynecological examination, and that we, as healthcare clinicians, have to emphasize that it's a total body. But more or less the health issues such as heart disease, cancer, et cetera, extend far beyond the simple gynecological exam.
Absolutely. And let's talk about what you do, Heidi. Nurse midwife, you think about the woman who helps with the birth of a child, but really your role here is much more.
Well, the nurse midwives now are known to be healthcare with women for a lifetime. So we start with teenagers, which is near and dear to my heart as a mother of two, and then we move on from there. And I'm getting more and more interested in older women as well. I'm not sure why.
Very good. Another thing we want to talk about heart disease is that a woman dies from heart disease every 34 seconds.
Correct.
And so what do you want to tell women about heart disease?
Healthy lifestyle is where you start. No smoking, exercise, nutrition. And those are things that even in a routine gynecological exam, both Heidi and I and other members of our team stress to all of our patients. It's an important educational process. Oftentimes, the only healthcare provider that a woman sees in her reproductive years is a gynecologist or a midwife or another healthcare professional, and therefore we have to expand our focus.
Do a lot of women ask you about heart disease, Heidi?
No, I would say probably not. So
Really?
it's really important that we bring it up.
Exactly.
And that's why it's really important to get your preventive care, because it's during that exam that the practitioner gets a chance to go over your family history, your lifestyle factors that might influence this.
All the risks.
Another statistic we need to share with everybody, 1 in 3 females in the United States have some form of heart disease.
Correct.
That's an extremely high number.
Correct. Again, directly reflected by a healthy lifestyle or lack thereof.
Exactly.
And it's silent, so women wouldn't know
Right.
until something happens.
But the preventative healthcare screenings are important to detect cholesterol, diabetic issues, all the things that can lead to heart disease.
And you really need to know your family history as well.
Absolutely.
Very good. Let's move on to cancer. 3 most common cancers. Women are, well, I think most women know breast cancer, but lung and colorectal cancer are up there as well. Lung cancer being the most deadly form of cancer in women. Now that's, most of us think of as breast, but it's really lung cancer.
It is lung. Exactly. That's why we focus so much on smoking cessation programs for all the departments, ours, internal medicine, health promotions, even pediatrics to prevent the adolescent from adopting the habit at a young age.
And screening really isn't there for lung cancer just yet anyway, not a really good screening test.
No, but we're screening when we're saying, do you smoke?
Correct.
And
That's
we ask
true.
them that at every single visit.
Correct.
Very good. And of course, the other statistic that we want to share with everybody with this one is in 2010, about 270,000 women died from all forms of cancer. All forms.
And we have screening programs, mammography.
For most cancers, exactly.
Breast, pap smear for cervical cancer, so that it's very important to be proactive in your health care.
Again, diet is also a big part
Absolutely.
of prevention in cancer.
Yes. And exercise.
And colonoscopies. Nobody
Yes.
wants to talk about those. Nobody wants to have one.
You're right.
But that's
But at a
important
certain age,
too.
you got to have that one too, right?
Exactly.
At 50 years old, I think. Now let's move on to stroke. More women than men die each year from stroke. Now that's surprising.
It is, but again, hypertension is called a silent killer, and unless you're screened for routine, blood pressure checks, there's no way to know the damage that's being done to your blood vessels.
And stroke kills twice as many women as breast cancer every year.
Yes.
Do women, when you share these facts of women, are they as
Sometimes they're astounded.
They are.
And
They've
they
gotta be
oftentimes don't
surprised.
understand why we're asking the questions.
All right, well, more than 30% of strokes occur in women before the age of 65.
Yes.
Goodness, I just can't believe the numbers for women, and that's why we're all here talking about it. Now, what are some of the tips? You and I have already discussed some of that. That's diet,
Exercise,
and anything
smoking.
else?
preventative health care.
Preventative health care. When you say that, you're talking about the specific tests you need to
screenings.
take every year, or
Screenings. Oftentimes a woman or matriarch of a family often guides the family's health care, but doesn't take care of herself. So you can't neglect your own well-being for the care of others. So the routine screenings that will involve the BMI, which is the body mass index, cholesterol screenings, glucose screenings,
the colon
mammogram.
cancer tests.
Exactly. All those tests are very important, not just a mammogram and a pap smear.
Here's that complete list right there. Anything specific you want to talk about right now? We can talk about the mammograms, because I know a lot of women need to get those mammograms every year. But certain ages, you don't really need them as much. From age 20 to 29, women do not need a mammogram?
Well, unless there's extremely high-risk circumstances, family history, et cetera, or if a mass is found, then it may be an adjunct to the diagnosis. Breast tissue is very dense before the age of 30, so sometimes an ultrasound as opposed to a mammogram would be the tool of choice. But it's not excluded, it's just that it's only recommended as an annual basis after age 40.
That's right. And Heidi, when women come to you about this, is breast cancer the #1 thing that people
It's often the thing that women aren't thinking about, and they've often had a family member who was affected by breast cancer. So women are scared of breast cancer.
Yes.
Do you find that most women are getting a mammogram, or do you have to encourage them?
Some women say, oh, I don't want to do that because it hurts. And I always say, think of it as a breast hug. The tighter,
Oh, that's
the
a great
tighter
idea, Heidi.
The tighter they go, the better they can see. So you want a nice firm mammogram.
Very
That's
good.
a great way to put it.
From age 30 to 39, you should find out if you have a higher risk than the average woman.
Correct.
And that is, how do you find that out? By talking
Basically, the family history.
Family history, right? Well, most women, hopefully by then, know their family history.
Correct.
All right. And from 40 to 65 plus, you say you got to get that mammogram every year.
Yes.
You can't miss it.
It's controversial these days. There have been some different ideas about it, but I'm still encouraging women to do it every year. And that somewhat depends on their family history, though.
Okay, and Dr.
Same.
Same thing. I think that a lot of women don't really know when it comes to breast exams, self-breast exams, what to look for. Can you give women an idea as to what to be feeling
Well,
for?
I think women are afraid that when they feel a lump, that it automatically means a problem that could include cancer. I mean, that's everybody's greatest fear in many ways. But I try to encourage people to learn sort of the landscape of their own breast tissue. And that it's sort of like, the furniture we placed in this room, that, if the furniture moves, it becomes larger, it becomes uncomfortable, that's when you need to report it to your clinician. So I still think it's an excellent adjunct to mammography and annual examination by a physician.
It's just a way of getting comfortable with your own body.
Exactly.
And knowing knowing your body.
All right. And you have a big event coming up. It's Women's Health Week on Thursday, May 12th. What should women expect?
Well, in the lobby of our OBGYN department is going to be a table set up with all information regarding healthcare screenings, and we encourage everyone to attend, please.
All right, so every question you have, you're going to answer it for us, right?
We're certainly going to try.
It's our favorite topic.
All right,
That's
for
right.
more information, you can go to hillhealthcenter.com, or you can call the number 203-503-3000. Thank you both for being here.
Thank you for having us.
Thank
so
you.
informative. We appreciate it.
Thank you.
It was a pleasure.
You're welcome.